So we hope to make that available for everyone after the meeting is over. And we will plan to send out some notes and a way to access the recording, hopefully within the first week after our meeting is completed today. Please use mute when you're not speaking. I have been using the mute all button as demonstrated incorrectly a moment ago, but I'll continue to do that to reduce background noise, and we'll try to be attentive to our speaker and make sure not to mute them as well. But if you have a question or comment, we do want this to be as interactive as possible, considering the number of people that we have joining us today. So we will, you should be able to unmute yourself and make comments or ask questions if you are able or willing during the conversation. But you also have the ability to use the chat if that's an easier way to get a question in there. We'll be keeping an eye on that. Call-in users, there's lots of them in this list today. So please take a moment to right-click your name and rename yourself if possible. Also, type your name and organization in the chat if you haven't done so already. And that way we can kind of keep an eye on who's joining us today. Feel free to add your pronouns to your introduction if you would like. And then we do have staff monitoring the chat. So we'll keep an eye on questions that are coming in. And you're welcome to engage and ask questions in the chat box throughout the meeting. And so I'm going to do one more mute all, and then I'll kick it back to Lori. So Lori, you might have to unmute yourself first. Okay.
Okay. Am I unmuted, Jennifer? Can you confirm?
Yes, you are.
All right. So I see that Colin is bringing up our agenda for today. Just before we get started, as Jennifer referred to a little bit earlier, we did have some strange occurrences with our attempted meeting notice yesterday. So I apologize if anybody got a cancellation. I'm getting a lot of feedback noise here. Hopefully that's better. Anyway, so we apologize for the confusion. Really don't know what happened. We're still trying to figure it out, but glad that you know, so many of you were able to get the all right. Lots of background noise still, but I will keep on going. So again, welcome. We're really excited to get going again with the FURS project. As many of you know, actually, I'm going to turn my camera off here because I think that might be causing some of the problems. All right. So as many of you know, we had to take a bit of a pause, and I'm going to explain that a little bit. What had happened is in this environment where we needed to explore some budget cuts, the governor's proposal did include a full cut to the funding for the FURS program in the initial stages. So we, of course, you know, put a pause on all of the activities, and it was unfortunately one of those things where it was a day by day. We weren't sure what's going to happen, and we were unable to, you know, share some of the information until much later in the process. So apologize if folks were wondering if we just kind of dropped off the planet, but that's kind of how the budget process works. But then as a result of AB 79 in the final budget bill, the program funding was restored completely, so we were able to get started again. I thank all of you. I know there was many advocates and stakeholders that did a lot of work, with the legislature, et cetera, so that we could continue with FURS. So thanks to all of you that may have been a part of those activities. As of the signing of the governor's budget, we do have full funding for the FURS program for 2021 annually beyond that. So that's where we're at. We decided that the best approach would be to reconvene the larger group today, since we have had several months with no meetings. I believe most of the last meetings were in late March or early April. Wanted to get everybody back together. Let's give everybody a refresher on where things are at. And then we will be, scheduling some sub-work group meetings very soon, and really get rolling, because we have a very short time frame to get this program up and running. Couple of other things I'm going to mention. There was a few language changes made in AB 79 to the legislation. Most notably, there was some additional language added to allow for the program to actually begin prior to January 1st, 2021, if everything's up and running. That's a lofty goal, and we're hoping, to get there, but it's nice that that's an option. I know that one of the primary reasons that the decision was made to put FURS back in the budget was because of the service being something that can really help families in normal times of instability. But considering we're all going through with COVID-19, I think, it's even more valuable service in these times. There's also some other additional language that allows for counties to have some COVID-19 related plans as part of their initial mobile response teams, to meet the current situation that we're all in. And then some other language was added about allowing, there's a little more specificity to the counties who may want an extension to getting up and running by the first of the year. Just a little bit more specifics about what that would need to look like, and making it really clear that some kind of alternative response would need to be in place. So that's the main things. The rest of the language in the statute is the same. So that's good news. Next thing we're going to do is just a little bit of a status update. I'm going to let you know that the ACL, fortunately, was almost ready to go out the door when we had to take a pause. So we were able to pick that back up, add just a little bit to it with the change in the new bill. And it's in its final approval stages, and we expect it to be released very, very soon. At the end of the meeting, we're going to go into a little bit more about what the ACL contains. I'd really hoped to be able to share it today, but due to the technology glitches, we weren't able to do that. So a little bit more about that to come. Also wanted to let everyone know that the same was true for the request for proposal that would go out about a statewide hotline. That's also back in the hopper, and we hope to have that out very, very soon, and start the bidding process of finding an acceptable contractor to take on that work. Also, as I said, the budget was restored, so the $30 million available for the whole FURS program for 2021 is in the governor's budget. And so part of that will be for the statewide hotline, but the remainder will be allocated to the counties for their mobile response teams, and a county fiscal letter with those allocations will follow our ACL. So those are kind of some of the general updates of where we're at. Going to spend some time now talking about the subwork groups, but before I turn it over, before I go into the statewide hotline report out, does anyone have any other general questions, or are you guys seeing anything in the chat that I should address before we move on?
No, but I was just checking on the sound. It was rocky at the beginning, but it sounds much better now. So other than that, I think we're good to go.
Okay. Well, I think fortunately it was just the housekeeping and real beginning of the welcome that folks couldn't hear, but hopefully everybody heard everything that we said after that. All right, so as we may have some new folks also, so I want to acknowledge that. And so the way that the project is kind of organized is we have the large group that will meet occasionally, but the meat of the work will occur in 4 subwork groups. A statewide hotline group, a mobile response group, a data committee, and a communications and outreach committee. So that's sort of how we get the work done in between these larger meetings. I'm going to take a moment to talk about where we were at with the statewide hotline. Our last meeting was on March 17th. And we talked a lot about some of the warm handoff process, some things about the statewide hotline, the composition of the teams, a little bit more about how the process was going to work of securing a contractor, et cetera. And then we had a combined portion with the mobile response team because there was many things that kind of overlap that are very critical to both groups. So we had a period of time to have a group discussion. I think that was really fruitful since there is going to be such a connection between the statewide hotline and mobile response team to be receiving the referral from the hotline to go out and do some site work with families and okay, it sounds like we're getting some noise again.
This is I'm going to give it a shot. When also, FYI, it doesn't mute everyone. It doesn't work for all callers. So I've asked everyone to mute themselves, but let me give it a shot. Okay, you should be unmuted, Lori.
Okay, that's better. All right, so during that combined time, we spent some more time talking about exactly how that warm handoff will work. Talked about the availability of a portion of our child welfare system, case management system that will be made available to the statewide hotline staff so that they can get just a minimal amount of information if it's a child who's or caregiver that's currently involved with the system. So they will have access to snapshot and facility search for those that are familiar with it. So we kind of gave some folks some information about that and provided a little bit of information about the system change proposal that we're putting forward for FURS information to be able to be entered into the CWS CMS system as appropriate. Another thing which we're going to spend some more time talking in depth about today is what we're calling a summary report, which is, in a nutshell, what process has been developed to communicate the outcome of the mobile response team back to the case carrying, social worker or probation officer for our kids who are currently in care. So we'll go over that a lot more today. All right, so I'm now going to turn it over to Jennifer and her team to give us a little bit more updates on the mobile response.
Really quickly, Lori, before we get to that part, we had one question in the chat. What will the review process be for the CFL, ACL, et cetera? I didn't know if you wanted to address that now, or do you want to hold off until we get to the ACL part?
No, I'll go ahead and address that now. The ACL already went out for stakeholder review, and so that portion has been complete. We got feedback, incorporated all of that feedback. I apologize if some of you are new and weren't able to provide information for the ACL. However, it's just a start. Like I said, we'll talk more about it, but it's mostly just a really clear overview of the statutory language and the requirements. So there will be more guidance and more issuing of letters, I'm sure, throughout this process. So there will be other opportunities to get more specific information into our guidance that folks are thinking about. The CFL will go through its normal processes after the release of the ACL.
Perfect, thank you. Okay, just an update on the data and outcomes work group. When we last met, I believe that was on April 2nd, we were working through some of the specifics for the summary report so we could align the information with the data that we may need moving forward. In addition to that, we finalized some of the information that we needed for the system change request that we're going to be submitting for the CWS CMS proposal to make a small change in CWS CMS to allow a mobile response to be recorded. So that was kind of where we left off. And thanks to some of our data folks, I have received some help in figuring out what exactly to ask for in our system change request, and we'll be working on that shortly to get that submitted and get that process moving forward. We are holding off just now on a tentative date for data, our next data and outcomes work group, so that we can kind of see what our questions are for that work group, and we'll be scheduling one probably, I would guess, sometime in the month of September. So that's about it for data and outcomes.
Hello, this is Colin.
Oh, thank you. I was going to turn it over to you, Colin. Thank you.
Yeah, thank you. This is Colin Williams with CDSS, Permanency Policy Bureau, under Lori and Jennifer. And I co-chair the Communications and Outreach Group with others in our Bureau. Our last meeting was April 1st, and primarily the work that we've been doing is identifying kind of our needed messaging and really kind of isolating the various populations that we need to get a message out to. We've honed in that there's probably a different messaging need for each of these groups, for current foster youth, former foster youth, caregivers, and social workers, probation officers, and service providers. Because each of those different groups has kind of a different way that they interact with this system. So we've been trying to establish kind of a central message, and what we want to do in our future work is to put that out to the rest of the communications and outreach work group to tailor that message to each of those groups in a way that we can get that messaging out One of the prime goals is to figure out how to really emphasize the positive nature of this program. Want to see this as another referral source. We want to be very clear that the usage of FURS is a positive accessing of resources. Amongst our other activities are obtaining a website, trying to figure out kind of the infrastructure for the website, the phone number, other forms of messaging that we might want to explore, email, direct messaging, text. As we'll see later in the presentation, we have a mock-up of our Coming Soon website, where we hope to have a number of FURS resources that will live there. I think primarily it'll be populated with the ACL pretty soon. Excuse me. And that's kind of the major work that needs to be done is really getting that website kind of built out, because that's where a lot of information is going to live. Our whatever materials we produce for each of these groups will also be available through the website. It will be the source of all FURS information. I believe that is that for that group.
All right, thanks, Colin. Wanted to give a little bit further information about the work groups going forward. We have Rebecca Buckmiller with us now. She has been very involved with the mobile response units and can tell us a little bit more about some of the things they had in the works, but also wanted to give you all a heads up that there has been, with several months of a pause, some shifting of priorities and responsibilities here at CDSS. So we may have a shift in some of the assistance with these work groups going forward. Rebecca?
Yeah, thank you. Good afternoon, everyone. This is Rebecca Buckmiller. I am with the Resources Development and Training Support Bureau, Integrated Services Unit at CDSS. I can give you a brief summarization of what the mobile response team subcommittee worked on for the meetings we had prior to the pause with COVID. Our first meeting was on January 7th, and as a group, we kind of collectively decided to move forward by prioritizing our areas of focus or buckets that we could work on in the time between each monthly meeting, so that when we came back together as a group, we would have some discussion and thoughts and present it to the larger group. So in February, we set up breakout sessions and did a share out of ideas, and what we came up with is our 5 areas of focus were team composition, regional approaches, connecting with ongoing resources, collaboration and connecting with other teams, and then we had the communication and data sharing regarding child welfare and juvenile probation, which I think might have predated the work group that was a result of that, a little bit just talking about that. It's a really important aspect. And then each area of prioritization was broken down into kind of activating questions to segment the work. So what we wanted to do is first look at each one of those areas of focus and whether it was a state mandate or there was county flexibility, because we needed to make sure that we met all the intent of the legislation and all of the guidance that we give, but we also wanted to make sure that counties, based on their needs, had the flexibility to implement. And then we created a set of activating questions and responded to those. So that was all collected with the intent of moving forward and breaking down the work into pieces that were easier to digest and move forward. Unfortunately, right after that was not long, was the COVID response, but we did have a meeting on March 17th. Partners, it was an overlay group with the state hotline, because we did discover as we came back with our meetings with the mobile response unit, as we kept coming back to how important that warm handoff was and what does that look like and how does that transpire So we did start taking a look at that in March. And just as a footnote, at the end of March, CDSS, some of the team at CDSS met with Casey as a consultation to hear about some of the work and experience that they've had implementing FURS like programs across, actually across the country, and had some. We're in the process of collecting resources and what others have done to kind of bring back to the group when we hit the pause. So that's kind of where we are now. As Lori mentioned, the leadership on the facilitation of this subcommittee will be shifting back over to Jennifer and Lori and their team. But my team is still heavily involved and actively interested in seeing FURS implemented. So I don't know if we have any questions or anything for me. Did I cover everything, Jennifer, Colin, Lori? Please feel free to chime in. I think I missed on that mobile response.
That was great. Thank you, Rebecca. I really appreciate it. And then, Lori, did we want to just kick it to Jessica really quickly? Jessica, if you had anything else you wanted to add or say before we move on to the next section?
The only thing I add to what Rebecca just mentioned is we did try to start parsing out some of the topics and putting some things together for work members to potentially react to based on the feedback that had already been gathered and to kind of further things along. And so that was around the time of the pause also. So I think the hope is moving forward that there will, on some of those topics, that we'll have some things maybe for the future meetings for folks to react more to, and some sort of best practices or principles that might be helpful in some of the areas where counties may be trying to, work out what to put in their plan.
All right, thanks, Jessica.
Point. Yeah, thank you, Jessica.
Sorry, I was introducing Jessica, but apparently I was still on mute, so sorry about that. Thanks, Jennifer.
Okay, gotcha. That actually serves as an excellent segue to the next section, which is the couple of items that we brought for the group to review today. We heard you loud and clear in that, repeated discussions. We did tend to keep coming back to the same topics, and it seems to help facilitate conversation if we have something to look at, something tangible to look at. So we really made an effort to have some items ready for you today to take a look at. And one of those is the document that Lori mentioned earlier. This is our FURS summary report. Just to call it out as it is, which is a work in progress. We are by no means saying this is our final product. We just heard some of the input that we received from our earlier work groups for some of the content to put in this report. And we're pretty open to suggestions and feedback. So our hope today was that we could take a look at this together and solicit your feedback for the summary report. So I think, Colin, were you going to walk us through the form a little bit?
Yes. So as described, this is a draft of a FURS summary report that we developed here at CDSS. It is definitely a draft at this point, with the intent of figuring out the best means by which to communicate information from a mobile response to a social worker or probation officer, where applicable, so that information can be utilized to continue to provide service to these families in a positive, helpful way. So we developed this document. I know one of the first things that we want to develop with help from the work group is kind of a description to drop in after the FURS summary report title, to provide some sort of instruction for just how this form should be filled out, to the purpose of the form. And to that effect, we want to kind of have a discussion on this, on how much information is expected or wanted to be shared between a mobile response and child welfare agency or probation department, and what are the best ways to actually share that information.
Just really quickly to add to that, Colin. So let me just give an example of one of the pieces of feedback we've received internally so far, which is that we want to maybe specifically call out that the summary reports should not be attached to case plans, for instance. So that's an example of maybe an instruction that we need to put toward the beginning of this report. But we wanted to ask the group if there are any other similar types of instructions or other instructions that you think belong at the beginning of this report that we should include to give some guidance to the mobile response person who might be completing this report.
And for anyone that wants to chime in, you can unmute yourself and comments or questions.
And you can also put them in the chat if that's easier.
So this is Jordan with California Youth Connection. So you sent out a report. Who will have access to that again?
So the purpose of the report is just to provide a very minimal amount of information from the mobile response team that goes out to help the family and or youth. And it's a way of communicating, like I said, a minimal amount of information back to the child or youth social worker or probation officer that a mobile response happened, that there was something that they called in about, and some folks went out to provide some assistance. We have heard and we've talked a lot in this group about it's not the type of report that will go into great detail or disclose a lot of information about the folks, either the caregiver or the youth. But we do want to ensure that the child or the youth's worker knows that this incident happened, that something, some assistance was provided, and then they can get a little bit of information about where they step in to further assist the youth and the family. So in terms of who would have access, it would be the mobile response sending it to the case carrying social worker or PO.
Is it possible to show us the entire, we can only see half of the report. Thank you.
Yeah, I'm just worried it'll be difficult to see, but I'll try.
And I just want to note we're getting some good suggestions in the chat. I'm jotting them down. So it was suggested that we indicate who took the report and how to reach them. I believe we have that on here somewhere. And then it would be great to have time and date referred to county. So that we didn't have, and I do think that's a good suggestion. What consideration is being given to whether or not law enforcement's involvement is warranted? So that I'm going to actually put a pin in that one because that might be worth some additional discussion. And
Jennifer, this is Lori. I just wanted to mention that we know there was so many glitches with the invitation. It was attached to the meeting notice. So for those of you that didn't experience any kind of cancellation or anything, you could pull it up to look at closer as well, because it was sent out ahead. Go ahead.
yes, also we have a suggestion here to include a time frame for completion and submission by mobile response team to the social worker or probation officer. I think that's similar to when it was sent to the county. Let's see what else. What is recommended for follow-up stabilization services? That is here. We'll get to that, I promise. Adding recommended next steps, also here. So that's on page 2, hard to see right now. So we'll continue scrolling through the form and show you more of what is on the form. In fact, Colin, do you want to just read through the form sections, maybe zoom in a little bit and give everyone a chance to see what's here, and then we can kind of come back to our questions? That might help.
Yeah, that's a good plan. Back beginning here, and we'll just kind of walk through it and then revisit those back from the top. But this way, it'll give everybody a chance to see the full document. So we have the date of the response, the time that the call was received, and that's from the call from the hotline to the county mobile response, and then the county's time of response. We have the response priority, urgent, preferably with 1 hour, but not to exceed 3 hours in extenuating circumstances. That's definitions from the legislature. Non-urgent, it's within 24 hours, or no mobile response, no mobile response required. If selected, please provide an explanation below and then submit the report. I think we'll make the instructions more clear that the rest of the report does not need to be completed if this is the selection with a proper explanation. So then we have kind of another instruction here to be completed after a mobile response team provides an in-person response, and to provide the details of that response to the county of jurisdiction where applicable. For youth that are no longer active with child welfare or with probation, there would be no county of jurisdiction. And so it does not seem appropriate to send these to anyone, although that can be definitely part of the conversation that we have if there are ideas in response to that. So then we have location of the location information. We have the county or the region of counties that sent the mobile response team. So this would be where the youth is located. And then we have the county of jurisdiction of the youth, if different from the responding county. So if you have a placed out of county, their county of jurisdiction would be the one where their court process is taking place. We have the physical address of the mobile response. We want to know the type of location that is, if it's home, school, community location, because this is not limited to just responses in the home. We want to know the participants. We want to know their foster status, if it's a current or former foster youth. If it's a caregiver involved, if they're a foster parent, adopted parent, birth parent, or other. Again, the definitions allow for consults other than the direct caregiver to be a participant in this process. And if there's additional participants, we want them to indicate the relationship to the youth. Contact information for follow-up purposes, primary and secondary languages for best practices, primary language spoken in home, and the sub-question of if interpreter services were needed and provided. Then is kind of a catch-all for anything that's not captured in the above information. We want to know the participants who received the mobile response and indicate their relationship to the child or youth, or non-minor dependent, if that be the case. We want to know who's responding, the mobile response unit members, their name and their role. We want to know a brief summary of presenting the issue. And again, as Lori stated, this is a very, very brief bit of information. It's not a narrative. It's just kind of setting the scene for that a call was received, a mobile response was, it doesn't say mobilized, but I'm trying to steer away from that language. Then a mobile response was provided, and a little bit of setting information. We want to know if the situation was stabilized and if a stabilization plan was created. We want to know a description of services. So this may include activities that the family engaged in prior to the response. This is also some of the services provided in the moment by the mobile response. And then last item, this is our draft language for right now, but one of the comments we've received kind of questions how much information to supply here. But I think one of the best ways, at least to start with, is to frame it in strengths and needs. Strengths so that we are providing actionable information to social workers and probation officers as to what works with the family, and then needs to help kind of identify what the ongoing needs, what ongoing services may help the family. So that is the walkthrough, and then we can kind of run back through it, having seen the document.
Yes, I just wanted to capture some of the questions that we're seeing in chat. There are some good comments and questions here. So this is a great question, and I would love to hear what the group has to say about this. Could the family request that this sharing of information not happen? Would a release of information be needed by the family? Would the family know before mobile response services that info would be shared? I don't know, do we want to read all the questions and then come back to each one, or?
Jennifer, is that what I was thinking might be best is first to kind of go over folks' suggestions for additions or changes to the form, and then to jump in with the questions.
Okay, that makes sense. So one of the suggestions for the form itself was to potentially add a footnote regarding the intended use of the form, if we're worried that it won't be used as intended. So that was a good suggestion to add to the form. So I'm focusing on content related comments and questions for the moment, and then we can come back to some of the kind of use cases of the form. Let's see. I think that was the majority of what I see related to content. Is there, oh, and then here's one. Should it indicate who contacted FURS? So who the original caller was. Also a comment about not seeing where the follow-up stabilization services would be included. So I believe that was on our page 2. Ah, there's a good one. This should be electronic, so a signature could be obtained. We did intend to add a signature and date at the bottom of the page. We just haven't gotten those on there yet, but that's a good point.
Jennifer, I'm also seeing a suggestion about adding something to indicate whether a CFT occurred or not.
Yeah, saw that. That's a good one. Yeah, so just for my own brain, we would probably only know that at the time of mobile response if a family was able to say they participated in a CFT, right?
Correct.
Or if part of the mobile response elicited a CFT.
Right.
Yeah.
I have a question on that. This is Melissa Lloyd. For the CFT piece, is that at the time, is the thought around that one is either being created or one has occurred by the time the mobile response is the responder, right, is, sorry, I don't have good words today. I've been on so many meetings, I'm so sorry. But is the intention of that question that one is started or has started because a family could answer that and a CFT, for example, could have happened like last week or 2 weeks ago?
I think the best thing to do is to throw that back out to the group and have folks weigh in on what what seems to make the most sense. Maybe I think we have some folks that have a lot more experience with CFTs than myself.
Right. This is.
Well, I think there's some confusion.
Yeah, I think it could be either. And I think that for families that have wouldn't be so much as when their last CFP was, but also for back to them if there was a crisis for possibly reconvening. But for our counties that are doing prevention CFTs, is that an opportunity to initiate that process as well? So yeah, I think there's a variety of ways that we can look at that, not just from when the last one was, but does the family have a child and family team existing already, and how can they be engaged to further support alleviate the need for calling for crisis and mobile response with needs are not being met.
Okay, so it sounds like there's a number of ways we can go, and we can work in between meetings to develop some suggestions on how to capture CFT information and what needs to be on there, and then have that to share back with the group along with other additions and changes for next time.
This is Melissa Lloyd again. I just want to add something. I think I would suggest that we need to be mindful about everything we're trying to capture on this, and then what are we doing with this information? As a county right now that has an urgent response team through one of our community providers, I will say that when there is an urgent response that takes place, there's conversation between the agency and my staff. And then from there, the social workers case by case make a determination about the next steps of what needs to occur. And they're absolutely in collaboration with the
mobile response provider
team. Yeah. But in terms of everything we're trying to capture on here as part of the CQI that's going to occur through launching FURS statewide, I would just caution us to the breadth of information we're trying to get on a form.
Mm-hmm.
Yeah, I definitely hear that, and that's why we're having this conversation. Because we definitely don't want it to be too much, but wanted folks' feedbacks about what things they do see are important and necessary, so that we can, change it up and make it something that is definitely useful. I think the primary purpose is that there is some connection between the mobile response and the folks who are working with that family every day, to ensure that whatever needs are determined have a place for good follow-up.
One of the assumptions we had to make in creating this form was knowing how often a social worker probation officer will be able to have that confirmed contact with the unit to communicate a lot of this information. So created this in the sense of, if this is the only communication that takes place between those two teams, which information needs to be communicated. Of course, we would love to be able to, promote a lot more communication between our mobile response systems and child welfare agencies and probation officers. But knowing how those all operate and the workloads, we know that that's not always a possibility.
This is Haskell. Can I jump in just for a second on that point? I do think we want to make sure that there's the communication that the child is under the jurisdiction of, child welfare or probation, that they are aware that mobile response went out. But I guess I'd be worried about saying that this should be the only communication. I mean, or might be the only communication. I think it's more of alerting them that the service was provided, but there's requirements about the coordinating with this, with existing providers that are part of the mobile response, like sort of requirements and tasks. So I also don't feel comfortable saying that this form would be sufficient, or a form would be a sufficient communication, and then mobile response walks away and there's no further communication or collaboration. So I guess I just wanted to throw that out there. I mean, I think we need there to be a way to make sure there's that feedback, that support was provided, and what is the level of information that the social worker or PO needs. But I also don't want to say that just sending a form can be the end of the story.
That makes a lot of sense. Thanks for that. The other thing that I wanted to throw out there is I don't know that we necessarily have determined that this form needs to is a requirement. So we could have some more discussions about whether it would be just a tool. And then also beyond that, I think we could have more conversation about it being, just a template that counties could make their own. Because we do have, every county has its own, personality and circumstances, and that mobile response teams will look somewhat different in each county. So there's definitely room for discussion about flexibility.
Yeah, and I just want to kind of piggyback on a few of the comments. I'm really glad to hear from you, Melissa, because that was one of the questions we had jotted down in advance for today's call, was to hopefully hear from those of you who have programs in place that are similar to or almost exactly like FURS, because we were curious what types of reporting back is occurring in those programs. We are aware that the best or the ideal would be a conversation between mobile response and mobile response and the case carrying worker. But, having come from that world, I'm also realistic about sometimes it is difficult to connect. And that was sort of the idea behind the form, is it's at least something, some brief overview of what took place, with the hopes that with the contact information and everything on the form, that there would be a direct contact at some point. But just acknowledging that sometimes that can be difficult to coordinate. We were hoping to have something to communicate, at least start a conversation between the case carrying worker and the mobile response provider. So I just want to again nod to some of the comments and questions that we're getting in our chat as well. I just want to first shout out to everyone that's participating in chat. It's wonderful to see all this feedback and comments. I did want to acknowledge a good question. We got a question about whether or not we even need a signature on the form. It's a fair point. I maybe was making the assumption that if someone is summarizing this, that we would want them to kind of seal that with a signature and date, but maybe that's not necessary. I'm curious what others think about that. Any thoughts from the person who asked that question?
Well,
Having the
one of the
signature.
questions I had was,
Oh, sorry.
sorry.
No,
This is
please go ahead.
Diana. Oh, I did ask that question about the signature. I mean, I think to Jessica's point, this is a summary tool. There's other communication mechanisms we hope will be occurring between the mobile response and the counties. So, signatures are intended to you're attesting to the truth or validity, or you're authorizing payment, blah, blah. And I just don't see this as that kind of a document. So and then we're just adding signatures, which is an extra step for folks. So I think in the interest of getting information communicated, expeditiously, and I'd like to see this in an electronic format as well.
The reason I brought up signature was that the idea I wasn't thinking about the person who wrote the report, wrote the signature, signed the signature. Are you showing this to the youth and the family? And are they, having knowledge of this? So you have confidentiality issues, but you also have this piece of paper floating around, whether it's electronic or not. So the question is not the person who fills it out might not to be to sign it, but does the youth and or the family, and that could be their family or the placement family, do they get a copy of this document? And are they attesting to that this is what occurred and this is what they got? So I guess there's all kinds of communication that you can have. I was thinking way beyond just between agencies. There's so much written about people that people don't have any knowledge of and they don't get to see. And then they go to court and they're in shock about what people say about them. And that's parents, children, and youth. And I think we have to be very sensitive that we're not setting up a whole nother system of problems.
And this is Diana. I completely agree. And I think from what I heard previously, the idea or the goal is this is not part of the child welfare case record. This is not evidence that comes into court.
Correct.
This is something that's outside of that entire process. This is meant to be not a process that creates distrust. So, clearly we're going to have to do other things in addition to this form to build that case, but formalizing it in that way, that's not the direction we want to go or we hope to go.
No, definitely not. Thanks, Diana. That's a good point. There's a lot of considerations that we'll have to do some more thinking on. So this is exactly the kind of discussion we wanted to have so that we know the questions we need, perhaps, follow up. Some of these we may need to, ask some of the county councils to weigh in on that sort of thing, some of the legal questions. So we will definitely take note about, I'm seeing a lot of questions or comments about, how will this be transmitted, the security, the confidentiality. So I don't think we're, prepared to give a lot of answers to that today, but we now have a good bucket of questions on that topic to have further discussion on in our other work groups, but also, to follow up with those that may need to give us some good feedback.
Yeah, this is all really helpful. Some of these questions, I don't even recall us having any conversations about them yet. So this is great food for thought and definitely will help guide us moving forward. I agree in the intent behind it. It looks really, formal when it's written out into a form, but the intent was to be casual. So that is a really valid point that a signature probably communicates the message that this is a lot more formal than we intended it to be. If I may just loop back one more time to Melissa and others who are working with systems or programs very similar to FURS, are you doing any kind of written report back to the counties at this point, or is it all verbal? I would love to hear from you. Melissa, you're on mute.
Sorry. I don't know if there's an actual written report. I want to say that there is, but I would need to touch base with SAC Children's Home, who holds the contract for this. I know there's definitely email correspondence, there's verbal correspondence, but I do not believe there is an official written report, but I can find that out from our partners.
I'm also curious if we have any social workers or POs on the call today that could provide any information about, as the youth worker, what would you like to see, or what are your thoughts about the communication from the mobile response?
Hello, hi, this is Adrienne Chambers from Alameda County Probation. Can you hear me?
Yes, we can. Thank you.
Yeah, okay. I think that the form as it stands provides a lot of great communication regarding issues and details of the response. But I would like to see, make sure that that form is actually relayed as soon as possible to the case carrying officer so that they can do whatever follow-up is needed. I think the formality of the signature is not that much of a present issue for us, as opposed to just being able to see what actually took place so that the case carrying probation officer can follow up with the family.
Thank you. That's helpful. Anybody else?
Well, then I would also like to add on the question for the counties that are currently utilizing a mobile response system and having that communication with their child welfare agencies. Is there anything in addition to just regular practice that you're doing to ensure that that verbal coordination occurs? Because it seems like that is the primary way that this needs to occur. But if it seems like a report is like an extra step, is there anything that's being done to kind of go above and beyond to really ensure that that verbal communication occurs between those two groups? That would be helpful for us to know as well so that we can provide guidance to other counties.
Well, this is Melissa Lloyd again, and from the feedback that I've received, both from the source directly, which is the name of the mobile response in Sacramento, and our behavioral health partners and child welfare staff, it seems to be working well when there is email correspondence and phone calls. And some descriptors of working well are where we have had ongoing collaboration when there's been mobile response intervention, to where the mobile responder individual, I guess we'd call them the mobile responder, will then attend CFTs. They will stay in touch until there is a connection, if it is a child or youth that that is not connected formally with the behavioral health system. So there's kind of that ongoing, there's kind of a quick established relationship, and then a determination of what those next steps are. And that's made fairly quickly because the mobile responder knows very quickly, because they have access to the right systems to see if a child is connected with behavioral health already. And then that mobile responder, in addition to working with the child welfare social worker, will also work with the practitioner should that child or youth be connected. They also will establish relationship with the caretaker, and there have been times when the same mobile responder, if appropriate, and if the stars align, can be a continued resource so that there's familiarity with the responder. So if you think about a teen who is in a resource family home and they're really struggling and they've got some behaviors, some significant behaviors, and we're working towards stabilization, to have, and I think most people on the call understand this, of course, to have a new responder come out when a resource parent is finding the source to be beneficial. There are some relationships that are created that, as appropriate, we try to sustain, or I should say they try to sustain. In addition, the other thing that we're doing in Sacramento, which, every county is different, but we have office space in our placement services unit for mobile responders to come and work out of our office. And in our placement services unit, we often will have youth, anywhere, right now in our population, it's really like between 3 and 10 youth, teenagers, who will kind of come in and out of care. and they'll show up at our placement services unit. These are the kids that don't always go to placement. But as an intervention for these youth, we have office space set up for the mobile response program to also have someone there on site. So just as something to think about for individual counties and what the needs are.
That's really helpful, Melissa. And I think, that's a lot more of that kind of discussion we also need to have at the mobile response subgroup meetings, so that as counties are developing their plans, they can hear, the ideas of what's working and what's not working there in Sacramento.
Yes, thank you. I also saw a comment. I was trying to catch up in chat, so I'm have jotted down a few notes. I saw a comment that we should ask counties to make sure to cover that in their county plans. I know that's on the list of items, but it might help, to your point, Lori, to drive that point home in our mobile response work group, to make sure that they're really doing or clearly identifying how they're going to manage the communication back and forth between mobile response and the case carrying worker. I also saw a comment from San Francisco saying that they are not using any written reports at this time. It's all verbal reports, it sounds like. So it sounds like that's similar to what Sacramento is doing. That's very, very helpful.
Collect aggregated data so we
Say
can
that one more time.
eventually track outcomes. We are collecting aggregated data from Seneca as our provider, so that eventually we can look at the impact on our outcomes. But it's at an aggregated level from them.
Okay, gotcha. Thank you. There was also a question about will families involved in voluntary family maintenance have access to FURS or open referrals, or just families that have or had an actual case? I don't know.
So I'll take that. All of the above. Everyone can access FURS. What it could be a little bit confusing is sort of we're focused, because we're talking about this particular form, on kids that have an open case. But that's not to forget that, any current or former youth or caregiver can access FURS. So yes, the families that are involved through a voluntary, I believe, could get served as well. We want this to be, more open than closed. But the form itself, if it were to be used, would meet the need for a kid that's currently in care.
On that note, there was a comment in the chat a while back when we were just looking at content, but since we're kind of now talking about where it goes, there was a comment about filling these out for former foster youth as well, so that we could send them to the Department of Social Services for data and tracking purposes. Now, I do remember that exact topic coming up in a previous work group. That was my original assumption about what this form would be used for. And I remember hearing loud and clear from our work group participants that we did not anticipate this form going to the state, that would be included in the aggregate data, similar to what our San Francisco partners were saying, that would be included in aggregate data that the county is reporting back to the state. So we wouldn't need the specifics that are listed here in this form, but just curious if any others had any thoughts on that.
This is Jessica. I will say I agree. I think the level of detail isn't something you necessarily need sent back to the state, but I think when we're thinking about the aggregate data, we should think about what data do we need, like the data on was it an urgent or non-urgent response, and what time frame did they go out? You know, I think we've talked about even getting satisfaction information from the families about, you know, whether what they received was, you know, helpful. I think that kind of aggregate data we do want to make sure that we capture in some way. But I think in terms of knowing what the child's assessment, you know, like some of the questions that are more detailed, that to me doesn't seem like it would be necessarily needed, and maybe would raise concerns.
Gotcha. Thank you. So I just want to kind of throw it out there one more time to see. I think I've caught most of the questions in here. Let's see. We just got another question. Isn't the state who will originally receive the call and then be routing it to the counties, make the determination about whether it was urgent, etc.? Good question.
So let me try and tackle that. The calls will originally come into the contractor who will be running the statewide hotline. And they will be doing the first level of communication with the caller. And so it depends on what the needs are. If you know, the statewide hotline staff is thinking the family is either asking for, or the youth is asking for, or they would benefit from a mobile response and are interested in that, the handoff would be done from the statewide hotline staff to the county mobile response team staff. So I think that was the first part of the question. Jennifer, was there a second part of the question that I missed?
Just who's determining the urgent versus non-urgent?
So that's a good question. I think that would be determined, you know, during the warm handoff process as the county mobile response learns what has been shared with the statewide hotline. You know, the level of urgency would be determined in that warm handoff. But I don't know that we've, you know, finalized the details and made permanent decisions on that. We could still have some more conversations about that.
I just wrote that down as a great question for our mobile response joint meeting coming at the end of the month. I did want to call out this additional question. We had a question. The form is for children and youth currently in care. Does that mean currently in out-of-home care or with a current open child welfare case? Many counties open formal case on voluntary family maintenance or family preservation cases, even if the child never enters out-of-home care. And I will tackle it with my best guess and then let others clarify. So I believe when we're defining current foster youth, we're referring to anyone who has an open case or is working. I would consider voluntary family maintenance an equivalent of that, because they would be working with an assigned caseworker who would probably want to know that a mobile response was completed, and therefore there would be someone at the county to communicate this information back to. That's just my assumption, but you know, by all means, would love to hear others' thoughts on that.
There is a definition that's in the statute. We probably want to paste it in the is for those that are adjudicated, and then former. So either with a guardianship or they've exited to their bio family through unification or adoption.
That's a good point. Thank you.
And I would just add that nothing, I would just add that nothing would prohibit a county from cases that aren't yet in the system. You know, it's funding, resources, et cetera. That could be the issue there.
Gotcha. Okay. We have more questions. If a family called and there was a psychiatric emergency, would this be routed to the mobile response or to the county's mobile crisis team if they have one? I'm concerned about delays in the call getting to the right folks when there is a psychiatric emergency need or 911.
So the statewide hotline staff will be trained, to handle those kind of emergency nature calls and make those decisions. So yes, definitely, if something comes in that is a high-level mental health crisis of an emergent nature, they would be assisting the caller in accessing those appropriate emergency services right away, rather than handing it off to the mobile response teams.
This is Jessica. I just wanted to, we've talked also a little bit in the state hotline group about maybe situations where it makes sense because it's such a high risk determination based on the call where you do need to have 911 called, but where a mobile response team might still be appropriate to go out. There may be some circumstances like that. And we've also talked about making sure that there's the FURS mobile response system has to have it's coordinated. So there's a single county point of contact, but within that, the plan would, determine what, given certain circumstances, which team goes out. So I just want to make sure that, because I know there's been some confusion around, what FURS is intended to cover. Is it only crisis? Is it not crisis? And I just want to say, from the standpoint of when we were building it, the idea was that it was, making sure that we are meeting the whole continuum of needs from, situations that are not going to rise to what someone would consider a crisis level, all the way to making sure that this population of youth can get their needs met 24/7 with a mobile response for a crisis issue also. And that may already exist in some places and not in others.
Perfect. Just to follow up, it looks like Diana, thank you, put the eligible population definition in the chat for us. Current or former foster child or youth includes a child or youth adjudicated under sections 300, 601, or 602, and who is served by a county child welfare agency or probation department, and a child or youth who has exited foster care to reunification, guardianship, or adoption. And that's up to the age of 21. Thank you for getting that so quickly. I do see another question here. How will family know or agree to their info being shared? If they know info will be shared with the social worker or probation officer, then the family might not want to use this service. I think that's one of the primary concerns that all of us have about ensuring that whatever mechanisms we're putting in place to document, the mobile response for follow-up purposes does not create a barrier of any kind for entry into this service. We don't want youth fearful of calling the hotline because of a form we create. So that's a huge consideration and definitely something I'd like to hear more about.
I think it's a good point about the form, but just in a more general sense, there are requirements within the law about communication between agencies that the family would need to be informed of by, whether it's the statewide hotline team that's speaking to them at that time or the mobile response. Then yeah, definitely a consideration. Hopefully the training of the staff members would help those that were actually responding to those kind of questions and working with the families with ways to encourage them to be comfortable that all parties are intended to help. But yeah, there's a minimal amount of information that's required in terms of sharing. So we need to be informed of that. I see that there's probably a number of questions that we didn't quite get to, but in the interest of time, I do think that we probably want to move on with the agenda now. But I very much appreciate all of the rich discussion, and we will, as we talked about earlier, trying to capture all of the information in the notes. And I think we've identified a number of key discussion points for our follow-up sub-work groups. So again, everyone, what we will do in addition is some of the things that seem to be sort of mutually agreed upon in terms of the form, we'll try to make those changes and send that out for upcoming meetings as well.
Yes, and I just want to add that, we'll make sure to send out a copy to the entire list of the summary report. Just one more time, let's hope that the gremlins in the computer do not stop us from sending that. And make sure that you all get a chance to review it again, and you're welcome to send comments and feedback to our FURS@dss.ca.gov inbox. We'll show you that again before we call it for today. But I just don't want you to think that the conversation has to stop there. So by all means, if you think of something later or you have a chance to take a closer look, please continue to send your feedback. We welcome it. Thank you.
All right, can we get the agenda back up on the screen now?
There we go. Excellent. Okay, so Alicia, are you ready to share your webpage draft? So the next thing we wanted to take a look at is we recognize that we will need a webpage for FURS. And so we have a lot of ideas for what we want on this page. So please keep in mind that this is a very, very early draft of a starting point, we should say, for our FURS website. But we just wanted to take a look at that with you today, at what we've got planned for kind of an early start to the FURS webpage, and then take suggestions and feedback about what future content might include. So we just started with something very basic, a description of what the FURS program is, that our goal is to have it up and running by January 2021, how FURS will help and why it's important, and then just a brief listing of the services that FURS will include, and contact information for the Permanency Policy Bureau. And then if you continue scrolling down, more of the services. Again, this will probably be one continuous page. It's just on a Word doc for now, so forgive the page break. And then, of course, the related legislation, and we will have our ACL added at some point as well. So we were going to start with what you see in the top portion of the page in the grid there, but other planned sections that we intend to add to this page over time are frequently asked questions. We may have some technical assistance questions that we'll be able to add to the page. Any assessments or forms that we are using or create as helpful templates for our counties to use, and then any additional resources. For instance, right now we are working on a county, I hate to use the word template, more like a sample county plan, so that counties might have one to use as a guide. We're working on that now and hoping to get that going soon and sharing that out with our groups here for feedback. So that's an example of something we would want to put on the page. And then we would love to hear and or get your ideas for any other information you think might be helpful on our FURS webpage. So you're getting a first look at the skeleton of our page to start, just to get us up there in case anyone comes to the CDSS page and does a search. And we will continue to grow and improve upon this over time. But we'd love to hear your feedback, suggestions.
This is Diana. I think it's important to make this as reader user friendly as possible. So when I see, for example, number 2, prevent placement disruptions, that's a lingo we're all familiar with, but it's not really, I think, a public facing website type of language we want to use. So I would just, there are things that are great though, you know, like the promoting healing as a family, like there's some great things in here. I just want to be mindful that we don't want to completely make the terminology our terminology, but the family's terminology.
Thanks, Diana. That's great feedback.
Great point. Thank you.
We get so used to it that sometimes we don't even see it.
So true. And we really do try to get rid of as much jargon as possible. But to Lori's point, sometimes we just say it so much, it sounds normal to us. So those are great points. Thank you. If you see any others, call them out, please. Just saw a comment in the chat to find another word for congregate care. Excellent point. Thank you. Writing it down.
Hi, it's Melissa Lloyd. I think adding something, I'm thinking of our kids, our youth in extended foster care, and how they might not see themselves really in 1 through 7. So maybe something to address them as an independent person, you know, like, I don't know any other way to say it. Just they may not be part of a family. They may be living on their own, and it may not be an issue with a caretaker. So just something that might be creatively stated here.
Yeah, that's really good feedback. We will engage our TAE partners to solicit some language and help with that. And I'm seeing in the chat that there's others agreeing with that. That's a really good point.
I'm seeing just a specific call out to have parents and youth review this, which is great. We definitely want that kind of feedback. This is just our start, but by all means, the more eyeballs we can get on these words, the better, because it'll be more user friendly for everyone. So thank you. Excellent suggestions.
I have one other suggestion is, and I think I know why it's stated this way. Ooh, did I freeze? Oh, maybe not.
I hear you.
Okay, so you know down in the box where it says staffed with operators trained in, is that because all counties may not staff this with social workers or clinicians? Is that why that word operator is used?
No, it's just a word we should change. Good catch.
Okay.
Yes, no, the hotline will definitely be staffed with clinical folks at all times, in addition to others. But so that is a poor word choice.
Yes, thank you. We'll fix it.
Sorry if I missed this earlier. Is this going to be on its own dedicated website? Like, will it be like a FURS website that the vendor, where will this live?
So it'll live on the CDSS foster care site. You know how you can go to our main site, click on foster care, and then a number of different options come up for all of our different work that we do. That's where our webpage will live. That doesn't mean that as we get a vendor and do some of the development of some of the outreach materials and things that they can't live other places as well, but that's where we're starting.
Okay, I guess I'm just wondering if we want to think about maybe 2 pages here.
Okay.
One, if you're the youth or a caregiver wondering, gosh, I need help, I'm not sure where to go. And then another that's your more typical DSS website where here is our generic information about our program.
Okay.
Something to think about, yeah.
I think that's a definite good follow-up conversation to have with the communications work group.
Mm-hmm. Yeah, thank you. I know that there is or we're asking our future vendors to provide ways of contacting FURS without a phone call, so via text or chat. And so maybe it's an assumption, but I would hope that there would be a place on that page provided by the vendor that would allow for those other means of communication. So I'm kind of making the assumption there will be 2 places, but I'm not, I think to Lori's point, we should write that down as a question and be sure to have that conversation. Good questions, though. That's why we really appreciate having something tangible to look at, because it gives us an opportunity to hear some of these questions and thoughts that we haven't really come across yet. So thank you. By the way, thank you for those of you who are suggesting alternative language. I love trained and caring counselors. That's a good one. I'm writing those down. Thank you. And we are keeping track of these. Also, just to let everyone know, someone did ask if we would be making these questions in the chat available. I am not super well versed in how a WebEx recording works, but I do have some of our team members that have been keeping track of what is in the chat, and we will do our very best to summarize them for everyone. So when we send out the notes, we'll have some of the chat conversation included in that. So I hope that helps. Someone mentioned here that LA County has an external website and Facebook, Twitter accounts with some examples of how to separate out parents, caregivers, and youth at dcfs.lacounty.gov. Thank you for that. Will there be examples of when to use FURS? So that's such a great question. We actually put together some scenarios that we used in our RFA convening that I was envisioning being really helpful to have here on this page somewhere. So that is one of the things that we talked about adding is some examples of types of calls that FURS would be able to handle. I do think that was really helpful for our RFA folks that participated because there were some calls on there that right off the bat, they were like, that should go to 911. But after we gave our kind of FURS pitch and explanation, I think they realized that there might be a way to divert some of those calls, which is our hope for FURS. So I do see this as a great place to include some of those alternate scenarios as well. Trying to see if there's anything else here.
I noticed, Jennifer, one other question was, when do you need feedback by? I don't know that we have a particular end date in mind. But when we disperse all of the materials from the meeting, we'll be sure to include maybe some timeframes around that. And but it is always something that is changeable. But we would like to get something going, on the soonish side. So we'll talk some more about sort of a deadline for initial feedback and provide that with the notes.
All right, if there are no more comments or suggestions for the webpage for now, again, another thing that you're welcome to give us ongoing feedback to our FURS inbox, furs@dss.ca.gov. And I think with the 19 minutes we have left, should we return back to the
agenda,
please?
All right, so I think we're doing pretty well on time. And as we promised at the beginning, we do want to just give you a little bit of an overview of what's in the ACL since we weren't able to actually have the document today. So we'll go ahead and do that now. All right, so now you can see on your screen, we actually have an ACL number. So that means we're really, really close. It's going to be ACL 2089. We will be providing, as I stated earlier, mostly just a very thorough explanation of the legislation itself and the requirements. So the, Assembly bill, originally this was in the prior budget bill, SB 80, but now the newer one is Assembly Bill 79, which establishes the FURS program and outlines the requirements. So we have a section, I think Diana provided one of the key definitions about who could use FURS, and that is definitely in the ACL, along with several other definitions that will help folks understand the best utilization of FURS. There's a section that goes over the statewide hotline and all of the requirements in the legislation there, as well as the county mobile response system. We do have a section that outlines the decisions that counties have to make. They can be in a plan as a single county, or they can do a regional approach with other counties as a group. Then, of course, we have some timelines for the county plans that need to be submitted to the department. And Colin, can you scroll up a little bit because the bottom is hidden on my screen? All right, thank you. So the other main piece of the ACL is the process for requesting an extension. As I stated earlier, there is some language in the legislation about that. We of course hope that counties are able to submit plans and get teams in place and up and running as soon as possible. However, there is a process for requesting an extension, and that's outlined in the letter as well. So those are the highlights. It really is coming soon. Hopefully you'll see it in its entirety anytime now. And we will make sure and do an email blast to all of the folks on this group when it comes out to make sure you get it hot off the press. All right, Jennifer or Colin, anything else we should mention about the ACL?
Not that I can think of. We'll keep you all in suspense. Colin?
Yeah, nothing else that can't be best explained by everyone seeing it for yourself as soon as we can possibly get it out there. I know, there's been a lot of instances where we say, oh, it's almost done. But I mean, seriously, it is almost done. We're not buying time at this point.
Thanks, Colin. All right. Back to the agenda for our final things.
All right, so with the last little bit of time that we have left, we wanted to let you know that there are a couple of things that we're working on. I mentioned earlier the county plan template, and then we're also trying to put together, we decided to call it a quick start guide, just some quick bullets to help counties start thinking about what they're going to need for their plans. Jessica, did you want to say anything about that?
No, I think it's just drawing information that they should have already seen in other places, but trying to kind of put it in one place for a little bit easier to think through. Like, what are some of the steps that you might need to do when you're thinking about getting started, and what are some questions you may want to be pondering when you have all the right people at the table.
Perfect, thank you. So we are trying to provide as much assistance and guidance as possible. We know that these plans can feel daunting when you look at the list of items and criteria that are a part of the plan, but we're hoping that with some samples to look at and some guides to help assist you, that will ease that process a little bit for everyone. We also wanted to know, though, in addition to the idea of a template, a quick start guide, are there any pressing needs that those of you who are getting ready to create a plan or have started potentially jotting some ideas down for your plan, if you have any, what is your most pressing need right now to help you get started? Hopefully that's not what you need.
They've got them all ready to go. They don't need anything.
Yay, that's good. I was hoping it wasn't sirens. That wasn't like an intentional sound effect to kick in there. Well, how about we leave that as a floating question? Again, please keep in mind that the FURS at dss.ca.gov inbox is manned, or sorry, not manned, monitored, that's a better word, by my team. And we're checking it constantly. So if you have any ideas, questions, if you're sitting down and starting to look at that ACL that's coming out any day now, and you're just stuck, by all means, let us know. We will be doing our best to provide technical assistance. Thank you, Alicia, for putting the inbox in the chat. So, definitely would like to get these in your hands. I saw someone ask, when will these be available? They are in progress now. We are hoping to share them with our smaller work groups that we're scheduling for the end of the month. Just to kind of leap ahead to those dates, we have some placeholders on the calendar internally for a joint mobile response meeting and statewide hotline meeting on August 25th from 1 to 4. We're making it a long one since it's a joint meeting. And then also that same week, August 27th from, I can't remember our times. Is it 1:30 to 3 o'clock for the communications and outreach work group. So those are kind of save the dates, but we will be sending out formal invites to those. Just as a reminder, those of you who saw the initial invite, we sent out a list of our work group participants for the smaller work groups, but those are ever changing. So if you have a lot of interest in one of our sub work groups, statewide hotline, mobile response, data and outcomes, or communications and outreach, please feel free to reach out to us through our FURS at dss.ca.gov inbox to let us know which work groups you're interested in. You are welcome to be on any of them you would like. More than one is fine. So just to, let us know and we'll get your names signed up on those lists. So the next invites will go out to the specific participants who have indicated an interest in our work groups for those topics. So if you really want to participate in those, please let us know between now and then. Did I forget anything, Lori or Colin?
I think folks are asking for the dates one more time. And so it's August 25th from 1 to 4 for the combined statewide hotline and mobile response meeting. 27th from 1:30 to 3 for communications and outreach. And then as we said earlier, we don't have a placeholder date yet for data, but we'll get that as soon as possible. So we will hopefully more successfully than what we went through yesterday, send out our formal invites through Outlook, you know, in the next couple of days. So if you didn't have a chance to catch those exact times, they will be coming soon. All right, so I think that, are there any other burning questions that you're seeing in the chat, Jennifer?
Nope, I just went ahead and typed those in the chat, okay. August 25th and August 27th. So thank you again, everyone. Thank you for bearing with us through our invite snafu. We blame the gremlins, but we really appreciate that so many of you were still able to join us today. Thank you for the wonderful feedback. I'm really excited about a lot of the information we gathered today. Really appreciate it, and I hope you all have a wonderful rest of your day.
Thanks, everyone.
Thank you.
Thank you.
Bye.